Good afternoon, everyone, and welcome to the California Department of Public Health and California Medical Association virtual Grand Rounds. I'm Dr. Kim Newell-Green, and I'll be the moderator for today's session, which is entitled From Avian Flu to COVID-19, How the One Health Approach Improves Human, Animal, and Environmental Health. I had only heard of the One Health approach by name recently, but the notion that the environment and animals have a profound impact on human health is not a surprise to me, as I suspect it's not to most of you. So I'm super excited to hear our speakers today discuss how, by looking at the whole picture rather than individual pieces, a One Health approach can help us to be more effective not only at preventing human disease, but also at creating a sustainable planet for all life. Next slide, please. Here are our speakers' disclosures. Next slide, please. And here's our agenda today. Next slide, please. Finally, just a reminder that our series is accredited for CME credit. You'll be sent a survey after the completion of the webinar where you can attest to the attendance, and upon completion of that, we'll send out your certificates. Next slide, please. So today we're going to change things up a little bit. We're going to begin by introducing Dr. Kim Conway, and after Dr. Conway's presentation, Erica Pan will finish that presentation and give the epidemiology update as well. So Dr. Kim Conway is a veterinarian acting as the One Health lead for the California Department of Public Health. Before her current role, she worked at the this California Department of Food and Agriculture, acted as the assistant director during the development and opening of a free veterinary clinic for pet owners experiencing homelessness, and practiced companion animal medicine in the greater Sacramento area. She received her Doctor of Veterinary Medicine and Master of Preventive Veterinary Medicine degrees from UC Davis and is board certified in preventive veterinary medicine. So thanks so much for joining us today, Kim. Carry away.
All right, thanks so much, Dr. Green. Hopefully you can hear me okay. Thank you so much for having me. You know, One Health is one of my favorite topics to talk about, but it's always interesting speaking to a large group because I assume there might be some people who have never heard of the topic of One Health. Some people think it's the name of a clinic or an insurance company. I get that a lot. But maybe you're already a One Health enthusiast, which is why you decided to register for this talk. And then I know in the true spirit of One Health, the CMA actually invited the California Veterinary Medical Association to attend this talk. So today there's physicians and vets in the audience, which I think is super great. And either way, regardless of your background or your familiarity with One Health, I really appreciate you all coming, and I hope you take away something new and valuable. You can go ahead to the next slide, please. So I'm going to start off just introducing the concept of One Health and giving a few examples that I hope specifically resonate with clinical providers. And then we'll take kind of a deep dive into the current avian influenza outbreak and how taking a One Health approach is necessary and what that actually looks like here in California. And then I'll pass it off to Dr. Pan. Next slide, please. So I realize I'm probably not your typical presenter and maybe wondering, why is a veterinarian talking to a group of physicians? Well, for one thing, our patients like to spend a lot of time together. Most of my patients have humans attached to them, and about 2/3 of Californians own pets, and all of them live in the same shared environment. So if you take a look at this image here, maybe this cute little baby is your patient, but what if his best friend was this little kitten? And what if this little kitten's favorite backyard spot is this kind of gross, muddy pond? I think you probably want to know that, right? And likewise, if this kitten comes to me and it turns out he's got intestinal parasites from all that time he spent in that gross puddle, and then I find out that there's one of these cute babies in the household who loves to pet the cat and then put his fingers in his mouth, I think we'd all be really concerned. But this picture gets fragmented when I see the cat and you see the baby, and we're not usually privy to what each other knows. So when you see a human patient and I see an animal patient, we're not just looking at just that patient, though, are we? We have to consider everything that's potentially contributing to the reason that that patient is coming into our exam rooms. What were they exposed to in the environment that made them sick? Is what they have contagious to another person or an animal? Did they get it from an animal? And then where does behavioral health come in? I can't tell you how many times I wish I had a physician in the room with me when I needed to have a really hard conversation with an owner about how their behavior was impacting their pet's health. And maybe you've all had times when you wish you had veterinarians to consult with when a patient comes in with some unusual symptoms after an animal exposure or a possible rabies bite. I know that one can be a big challenge. So these are just some very specific examples that I wanted to set the stage to demonstrate how much our animal health and human health realms intersect, and that these issues will continue to challenge us as a result of our shared environment. Next slide, please. Oop, one more, sorry. Okay, so that takes us here. What is One Health? Well, it's pretty simple. One Health is the idea that animal health and human health and environmental health are all connected. And sometimes that's a really great thing, but sometimes that creates some pretty complex challenges that one group cannot solve on their own. Next slide, please. Here's a more formal definition from the CDC. It says that One Health requires a multidisciplinary collaboration. So this is physicians and veterinarians, social scientists, environmental scientists, all to collaborate to solve together what no one group or profession can do alone. Next slide, please. And some research have recently challenged that typical Venn diagram triad that you typically see that I had on the last slide, and argued that it's a little bit more like this, that we as humans are also animals, and all of us animals live in this ecosystem, and that our health and this relationship between our health is constantly being impacted by social, cultural, and political impacts. Next slide, please. Okay, so I think the title of this talk was From Avian Influenza to COVID-19 or something, right? So let's talk a little bit about COVID for a minute. This is a fishbone diagram that we can use to assess the root cause of an issue. So if our issue is a zoonotic pandemic like COVID, the little fish head here on the right, if you're looking at the branch directly behind the head, that represents some of the human dimensions. And it's easy for us to say that a zoonotic pandemic maybe happened because we humans didn't have any immunity, we didn't have any vaccine at the start, it was a brand new virus, we didn't have enough masks and gloves, people were traveling all over the place, and there was quite a bit of misinformation. But that's not why COVID happened, right? COVID didn't spontaneously occur because we didn't have enough masks. Many epidemiologists believe it happened because of spillover. So this was a virus that was already in animal populations and spilled over into human populations because of increased animal-human interactions. And if you go back one step further to say, well, why are human animal interactions increasing? It takes us to the conclusion that habitat degradation as a result of climate and human directed land use changes are forcing wild species out of their natural habitat into more urban areas. I don't know if anybody's seen the movie Contagion. If you haven't, I'm about to spoil the ending for you. But Gwyneth Paltrow becomes kind of patient zero and accidentally unleashes an entire pandemic on the world. And at the end, we see how she got it. So it shows a scene where a tractor is plowing down a bat's natural habitat, and that fleeing bat flies over a pig farm, drops a contaminated piece of fruit onto this pig's den sty area. The poor pig eats the fruit, he gets sick, he goes to slaughter. The chef touches the pig while preparing the meal, doesn't wash his hands, and then shakes Gwyneth Paltrow's hand. It's truly a fantastic movie if you haven't seen it, and it was pretty wild to rewatch during COVID. But there's other pathways too. There's things like bushmeat consumption, wildlife trade, wet animal markets, things that are embedded in varying cultural values, food insecurity, legal and political issues that I know we can't address in this presentation, nor can you address them in your patient's exam rooms. But I do think it's important that we're educated about the larger causes of some of these issues and not just the effect that we see in our patients. Because from a preventative medicine standpoint, climate health and the changing environment are hugely impacting our work. And I don't know about you, but I didn't really get a lot of this information when I was in veterinary school. Next slide, please. And it's not just the threat of pandemics where our work intersects. There are plenty more examples than what I've just listed on this slide, but the point I want to make is that many of the issues we're specifically dealing with in California fall into this intersection of human, animal, and environmental health. We have Rocky Mountain spotted fever down at our southern border. We have foodborne outbreaks consistently linked to leafy greens, of which California is the largest grower in the country. Our wildfires like Paradise and Park Fire have disrupted homes not only for people but for wildlife. Homelessness is impacting people and their pets. We have had harmful algal blooms in our beautiful Lake Tahoe. I think I could go on and on. And we can't just look at these complex issues through one lens. We need to see all of the pieces to mitigate all of their impacts. Next slide, please. So I chose 3 examples that I thought might be of particular relevance to talk to you clinicians about: zoonotic diseases, antimicrobial resistance, and the human-animal bond. Next slide, please. So we know that about 60% of pathogens that are currently infecting humans come from animal origin, and about 3/4 of emerging infectious diseases like Mpox and even influenza are also of animal origin. And researchers have estimated this equates to about 1 new infectious disease every 8 months. And then to the right are some examples of zoonotic diseases, including vector-borne diseases. Maybe you have dealt with some of these in your line of work. So where does One Health come in here? Well, I think rabies is a really good example of where physicians and veterinarians and public health professionals could be communicating a bit more to make sure everyone feels equally comfortable with the most recent post-exposure prophylactic protocols and where to advise that a patient can go to get treatment. And then I think just in general, considering animal and environmental exposure when gathering your patient's history and developing relationships with veterinarians and entomologists and other professionals so we can all benefit from each other's collective knowledge when we have complex cases. Next slide, please. So antimicrobial resistance, I'm not sure we can really call this an emerging issue anymore. I think it is an issue. It's been an issue. It's going to continue to be an issue. And everyone has a role to play in stewardship. So in California, we have programs in place that restrict antimicrobial use in livestock. But personally, I think we still have some work to do on the companion animal side. People and their pets share close spaces. We prescribe antimicrobials of human importance in many of our pets. And companion animal veterinarians face a number of very challenging barriers to stewardship when we have limited diagnostic information on patients due to financial owner constraints. And on the human health side, I think there's still a lot that can be done for patient education, just from both sides. We and veterinarians need to educate our owners. Our owners are often your patients, so we can get them from both angles here. And we just did a study to understand what barriers veterinarians face to practicing stewardship. And I personally would love to see the study repeated in physicians to see what barriers you are all encountering with exercising stewardship as well. And then outside of the clinic, I think we should all be mindful of where and how we recommend that clients dispose of any unused antimicrobials, as those can end up in the environment, which feed back to our waters and then back onto the food that we eat. Next slide, please. So finally, the human-animal bond is one of my favorite One Health topics, not just because I'm a vet. I think it really reaches so many parts of the work that we do. So about 2/3 of US households own pets. This is true for California as well. And nearly all of them consider pets as part of their family. So we need to be thinking about pets when we talk about family health. How many of us here have thrown a birthday party for their pet? Or maybe included them in their holiday photos? Maybe some of us have tried to find a way to incorporate their cat in their own wedding. We do these bizarre things because of the bond that we share with our pets, and that bond not only makes us feel good, but it can actually have health benefits like decreasing stress and anxiety, reducing symptoms of depression, and encouraging physical fitness when we take pets for walks, especially in our aging populations. Where does One Health come in here? Well, unfortunately, there are a lot of disruptions to the human-animal bond. Things like extreme heat here in California can certainly limit the healthy walks that we take our pets for daily exercise. Disasters can force people to be separated from their pets during evacuations at a time when we probably need them the most. And unstable housing can have particularly stressful implications for unhoused pet owners. And this is something that I'm particularly passionate about, and it really crosses both of our lanes. So I'm going to talk a little bit more about that. Next slide, please. So in California, we have the highest proportion of unhoused individuals in the country, and up to a quarter of them own pets. That's a lot of unhoused people with their pets. And the benefits of their bond goes beyond things that you or I might say about our pets. I might say my pet, provides me companionship and entertains me, where some unhoused individuals have reported that their pets keep them warm and safe, protect them, and even kept them clean from drugs and alcohol because they wanted to be better for their pets. And they also have challenges that many of us probably cannot relate to. I have trouble finding a pet sitter when I go on vacation. They may not be able to go to the doctor's appointment because they don't have anyone or anywhere to leave their pet, even just for an hour. They can't bring their pet on public transit, and pets may not be allowed in the emergency room or in clinics. They also face stigma from potentially well intended but possibly misguided individuals who think unhoused individuals shouldn't own pets, even though that pet is probably what's keeping them going every day. And it's also possible that people and their pets are at a higher risk for exposure to shared sources of zoonotic diseases. Next slide, please. So a few years ago, some colleagues and I at UC Davis did a study to evaluate this. And we found that out of 6 or 7 zoonotic diseases that we tested, the prevalence of unhoused pets compared to house pets, the disease was not significantly different. We did unexpectedly find West Nile virus antibodies in both house and unhoused pets for the first time, but it was still equal in both groups. And even though this was a small sample size of about 140 pet owners, I can tell you that the reported benefits and challenges of pet ownership in the unhoused population were significantly different. And they were so compelling that it has really changed my perspective on this forever. I no longer look at a person with a pet on the road and worry about the welfare of that pet or wonder if they should have it. It almost brings me to tears thinking about how glad I am that they have each other. And then one of the most important takeaways I think from the study was that 96% of unhoused pet owners would not give up their pet for a better housing option. This is huge. We have so many efforts directed at affordable and transitional housing developments, but if they don't allow pets, these people are not going to, people who need the housing are not going to take it. Next slide, please. So I hope that this is something that you can take away with you today, that the human-animal bond is uniquely strong in this population. And as physicians and veterinarians, we really do need to lend our compassion, understand that everybody deserves access to care, help combat the social stigma around this, and perhaps advocate for housing that allows pets, because both of our patients need that. We also need some more solutions for unhoused patients to receive care by having somewhere they can bring their pets when they're being treated in the exam room. And if any of you have a solution to this or have found something that works for you in your clinical setting, I would really love to hear about it. Next slide, please. Okay, so I'm not sure if anybody recognizes this photo. Kind of in the left here is Half Dome. So this is a picture I took in Yosemite just this past summer. And it was actually the first time I'd ever been to Yosemite. As someone who lived in California their whole life, it was a little bit shocking, but I was really struck by just how big everything is. Like everything is really big and really tall, and you can't help but feel really small when you're standing there. And I feel like in those moments, sometimes we kind of let our mind wander. And I certainly had one of those moments where I started to wonder, is anything I'm doing meaningful? And I'm not trying to get a little dark and bleak, but I think it's important in our line of work when we try to measure if the work that we're doing is meaningful. We have to ask, is anyone better off from the work that we're doing? And I think thankfully in the field of medicine, the answer is really obvious. Like, of course we are. We're improving the lives of our patients every single day. But as clinicians, we also have the uniquely influential role to impact and improve more than just our patient, something that goes beyond our immediate focus and instead make the entire world and all the humans and the environment and the animals in it better. Next slide, please. So with that new perspective that we all now share, we're going to switch gears entirely a bit and take this approach and the idea of everything being connected and use that lens to look at what is going on with avian influenza. Next slide, please. So to do that, we need to understand what is happening in animals and in the environment to better understand what the risk is to people. Now, up until recently, highly pathogenic avian influenza has primarily impacted and devastated domestic poultry. When a flock becomes positive, the illness causes really severe symptoms in chickens and turkeys, and the infected birds usually almost always die. And since 2022, California has lost almost 9 million chickens and turkeys. And this has been either because they died and succumbed from the illness, or because the entire flocks had to be depopulated to prevent further spread of the virus. Next slide, please. The avian influenza virus is actually maintained in wild bird populations, and it's often migratory waterfowl like ducks and Canadian geese. And the virus can be introduced to a farm through these wild bird secretions, especially if there's a body of water nearby, like a pond or a lake, they're really drawn to that. And normally, or historically at least, HPAI, highly pathogenic avian influenza, has not been very pathogenic to wild birds. That term is usually reserved for how it acts in domestic poultry. This strain has been pretty unique in that while typically wild birds have just carried it and spread it, this strain, we're actually seeing the wild birds die and succumb to the virus as well. Next slide, please. And some of these wild birds are particularly concerning as we're starting to see just how far this virus has spread. It's killed penguins in the Antarctic. It might be in species like seagulls that humans have more regular interaction with in urban environments. And unfortunately, it even made its way into the critically endangered California condors. The small silver lining in this was that this actually prompted the USDA to have their first HPAI vaccine trial to try to protect these species. And that trial did have pretty moderate success, but currently vaccinating all wild birds is impossible, and vaccinating poultry in the United States is not occurring due to limits on global trade. Next slide, please. Okay, so here is where I personally start to get really depressed about this. It's just everywhere. The map on the right shows the variety of mammals it's been found in. It's even gotten to polar bears in Alaska. Cats have also been getting it. This case in Poland that I put here on the slide was strange because typically when we're seeing it in mammals, it's often the carnivorous mammals that are outdoors and feeding on infected bird carcasses. But these were indoor client-owned cats in Poland. We also just saw this happen in Colorado a few months ago too. I don't know if they ever figured out what was the cause of the Poland cat cases. Some hypothesize that it could have been due to owners feeding food that was made with raw chicken, or maybe knowing what we know now that rats can also carry it. Maybe rats were involved there too. I don't think at that time we knew. And then there's this just horrible story of thousands of elephant seals in Argentina. Moms and pups, population was just decimated, which will impact the population for years to come. I just saw a link just this morning of someone rewalking this beach where this happened, and they're seeing about a third of the population they would have expected. And since the pups in this group really could have only gotten it from their mother, it kind of sparked the first early concerns about mammal to mammalian transmission here. Next slide, please. And then we have the cows. A colleague recently said that no one had bird flu in cows on their 2024 bingo card, and I think she was right. In cows, thankfully, they're not dying off in mass events like the poultry. Most cows that get sick, they have abnormal milk production and nasal secretions. Some have died, but most recover. And so far, all cases have been traced back to an index herd in Texas that has epidemiologists thinking this was a one-time spillover event from some animal source into the cows. And then with just the sheer frequent movement of dairy cattle from farm to farm and from state to state, it kind of made its way through the central United States and then to California in August. And this virus has a very strong affinity for mammary gland receptors, so that's why most of the clinical signs and the viral load are associated with milk. Next slide, please. So I'm only going to briefly touch on the human health impacts since Dr. Pon is going to cover that. It's her area, not mine, but I did just want to mention that some of the impacts that we're seeing in addition to clinical illness, there are really significant mental health impacts to people who are involved in this. So poultry flock owners who really do truly care about their birds, they're often present when their infected flock needs to be depopulated, which is incredibly hard for them, and it's hard for the veterinarians who are doing it. And there are backyard bird owners who have chickens as their pets, who consider pet birds as part of their family, and then they lose them. And dairy farmers who have already had a economically challenging go of it lately are just trying to provide for their families and are having their livelihoods threatened with this now impacting cattle. So I think it's just really important to remember this part of it. And there's also a food safety and security aspect. The green line on this graph represents the price of eggs shooting way up in December of 2022. This was right around the time that some of the largest egg layer producers in California got hit with HPAI. So we lost this huge source of our supply. And this is very real for people who rely on these food for their families and who may not be able to afford commodities when prices go up. And then the milk. We know that pasteurized milk is safe for the public to consume, thankfully. But what about raw milk? We know that cats have gotten sick from drinking raw milk and from an infected cow. And we know that people have gotten conjunctivitis from the splashing of raw milk from an infected cow. But I think there's still a little bit of uncertainty and unknown about, if the milk supply will be impacted and if there are any human health risks to drinking raw milk from an infected cow. I'll defer to Dr. Pond's opinion on that, but it's just things that keep me up at night. Next slide, please. And then finally, there are also some environmental impacts. So I'll just say here that with 9 million birds dying from HPAI, that's 9 million bird carcasses to manage. There are multiple ways that this can be done. Incineration, composting, taking to a landfill or burial. Each option has varying impacts on the environment and on biosecurity and can be particularly draining on certain resources. Now there's added bonus of safely disposing of milk now that we have infected cows as well. And this being mindful of how environmental factors like bodies of water near farms put them at additional risk of introduction from wild birds. Next slide, please. So what does it look like to put all these pieces together in California? Well, it looks like this. We have various local and state and private and federal groups collaborating very closely across sectors and disciplines to address all of this together. Um, there's also involves collaborating with veterinarians and physicians. I've put you guys in this graph here. We need the veterinarians out there to be identifying symptoms in our animals and contacting the appropriate person if HPAI is suspected. And then we also need the physicians to be able to ensure that exposed people can get appropriately tested and treated if needed. Next slide, please. So one of the ways that we specifically at CDPH brought a One Health approach to our California response was by hosting a One Health workshop last August with the groups listed below. And this was important because each group has a different role in response to avian influenza. And it's really important that we understood our varying missions and priorities so we could align our shared goals as best as possible. And we actually did this just 3 weeks before we had our first dairy herd go positive in California. So this was really good timing and very valuable. So for example, next slide, please. We talked about how CDPH performs enhanced surveillance for respiratory illnesses and maintains resources that can be distributed to local health and other stakeholders. And while we do provide subject matter expertise and technical guidance, it's actually the local health departments that have independent authority. CDFA is the lead agency for emergency animal diseases that have human health or catastrophic economic impacts. And the California Animal Health and Food Safety Laboratory, which is located on the UC Davis Vet campus, but also partially overseen by CDFA, they do all of the preliminary testing for bird samples and milk and cows. So that's a lot of testing for one lab for the entire state. And then all the confirmatory testing is done out of state at a lab for the USDA. Next slide, please. We also have the California Department of Fish and Wildlife, and they do mortality-based wild bird surveillance. We have CalRecycle, which provides guidance for animal carcass management, and CalOSHA, which has the regulatory oversight over worker health and safety. And this includes farms and other work settings where animals are present and zoonotic diseases transmissions might occur. Next slide, please. Okay, these are my last two slides before I pass it on to Dr. Pond, and I just wanted to give a quick update on the cow situation in California, since you've probably seen a lot of it in news headlines. California is a very large dairy state with over 1,000 dairies, and we had our first herd test positive at the end of August. And as of last week, we had 259, but then I checked again this morning, and it's actually 278. And we're also seeing poultry cases right now as well. And then you might know that the sale of raw milk is legal here in California, so those farms are getting tested regularly as an added precaution. Next slide. So when a farm does become positive, that farm is quarantined by CDFA. The symptomatic cows get tested, they're separated from the healthy cows, and then they're monitored clinically. And then after the cows from that farm all recover, that farm can be released from quarantine after 3 consecutive negative tests. And then also when a farm is positive, CDFA will test all the dairies in the 10-kilometer radius from that farm. And they're also working with the USDA Wildlife Services to test cats and paradomestic wildlife on that farm. And then there's some financial support offered by various agencies that can help offset the costs of testing and veterinary care and other expenses. So with that, I will pass it off to Dr. Pond to talk more about the human cases.
Great. Thank you so much, Dr. Conway. Always a pleasure to hear her One Health perspective, and very grateful to be working with Dr. Conway to help bring us all together. So we're going to shift gears, and I'm going to focus on what we're seeing as far as human avian flu in California. Next slide, please. So just to kind of recap, some of this has been touched on in earlier portions, but what are we seeing and how do we think this virus is spreading from infected cows to people, for example? So, as Dr. Conway mentioned, we have definitely heard self-reported splashing of raw milk from an infected cow into a person's eyes and or nose or mouth. Certainly, like other contaminants or fomites, if you're touching your eyes or mouth with unwashed hands that have touched raw milk, cow waste, or other contaminated items or surfaces, we think these are the largest contributors to the human infections that we're seeing. There's also some interesting things related to what Dr. Conway mentioned, as far as we know that the milk and the mammary glands are where the receptors are in the cows for this particular virus. And so we know there's just a lot of virus in the milk. And then, interestingly, there are some avian-like receptors that we have in our conjunctiva and in our lower respiratory tract, but not necessarily in our oropharynx, where we normally have more of the other seasonal flu type receptors. We also have a lot of unknowns about inhaling tiny droplets of milk, handling sick or dead barn cats, mice, or other animals infected with the virus. And as previously mentioned, we have a lot of unknowns too about what drinking raw milk would do in humans. There's been at least a few reports in other countries where there were raw products from poultry that were consumed and then associated with disease. But again, most of what we think we're seeing in dairy workers in California has been largely, we think, from splashing or contaminated surfaces. Next slide. So just to kind of summarize again, too, this is an update from last month when we gave you an update of what's happening kind of nationally. So we're up to 46 confirmed human cases in the United States. There have been several that have been following poultry exposures, most recently in the state of Washington, which is it's the same clade as the H5N1 we're seeing here in dairy cows, but it's a different genotype actually that was seen in those poultry workers in Washington state. And then as far as infected dairy cows workers who work with infected dairy cows, we've had 21 in California plus an additional probable case. And then there was one case many of you have likely heard about that was detected in Missouri with enhanced flu surveillance. It was sort of on routine subtyping of routine flu testing that had happened in an individual that was not a farm worker. All of these cases in farm workers have had mild illness. Many of them have just had conjunctivitis. Some of the others have had a self-reported fever or other mild flu-like symptoms. And again, the clade that we're seeing in dairy cattle and our 2024 human cases in California is this clade 2.3.4.4b, not an easy one to say. And then this genotype is B3.13. There's been no evidence of person-to-person spread in the United States, and the current risk to the general public remains low, and we still have our priority focus on agricultural workers who are working with dairy or poultry. There was also a report over the weekend of a human case in British Columbia in Canada, and my understanding is the investigation for that is underway. They have had multiple poultry flocks in British Columbia detected with H5N1. I don't know the clade or genotype yet of that, nor of the human case, but we are following that closely as well. As far as I know from any formal reports from British Columbia, they have not had any dairy herds positive there, but we'll be following that information closely as well. Next slide. So this is just kind of a quick summary, a clinical and sort of testing summary, which I think is really interesting. We're keeping an eye on. And again, this is a very rare, human cases have been very rare and sporadic over the years, but certainly with the large amount of virus in the environment, we have now, due to proactive monitoring and working closely, local health departments working with farms and farm workers, we have detected the cases that we've seen. All of them have been male adult dairy workers. And most of them have been milkers, and then there's at least one that took care of sick cows. And this is consistent with what we've heard in some of the other states as well. All, again, have had very mild illness. There have been no hospitalizations in any of these California cases. Again, all of them reported just conjunctivitis, and then about a third had a fever, about a third with some myalgia or other mild symptoms. And then this is also really interesting, especially as we kind of continue to look at how we're doing monitoring and testing. If you look at the cases that we've had in California, all of them except one have had positive testing from their conjunctiva. The one that had a negative conjunctival swab did have a positive nasal swab, but only less than 40% have had a positive nasal OP swab, and less than half overall if you look at the 22 cases that have had either a positive nasal or a pharyngeal swab. And those are cases with symptoms. And then 2 of 22 had positive nasopharyngeal swabs at the back of doing it nasopharyngally. So again, it's just an interesting thing to keep in mind as we think about our testing recommendations and what kinds of testing we're doing. And then of the 20 cases that we have self-reported personal protective information, 80% reported using PPE, 3 reported not being offered any PPE, a little bit over half reported using eye protection, and then we only have specific information for about 6 who did report using goggles, 8 reported using face masks, 13 did report using gloves, and then 6 reported boots, and others reported using gowns. So this is kind of really where we're trying to focus our priority and efforts on how do we work and understand on, what are the most effective ways to have the most effective personal protective equipment in these settings that can still allow the workers to be functional and best protect these workers. And then I thought I would turn, next slide, to just briefly touch on wastewater surveillance, because that's been a great tool that we've gained from the pandemic. And there has been H5 specific wastewater monitoring across the country. Of interest, every state that has publicly reported their H5 detections has had positive HERDs except Arkansas. And the detections have mirrored some of the trends in herd infections in those states, and seeing increasing detections in the wastewater as herd infections increased. And actually, in many of the states that have already gone through having dairy herds positive and no longer have positive dairy herds, their wastewater surveillance reflected the decreasing detections as well. Next slide. So here in California, we have over 70 sites that are looking at overall flu A monitoring, and then over 50 sites in California are doing H5 specific monitoring. And 3 of those are in the Central Valley, where we're seeing a lot of positive dairy herds. And we have had detections in California at multiple sites, at 20 sites overall. And it's interesting as well, from mid-July to August, we didn't have any detections in California. And then in September, we did have 3 sites, just in Turlock, which is again in the Central Valley, and then in Southern California in San Diego, and in the Bay Area in Palo Alto. And then since October 1st, we've had multiple other sites detected. Most of them still seem to be likely dairy sources and are being investigated. In Turlock, we know that there are high concentrations consistently, and there's multiple dairy processing plants there, including one servicing H5 cattle impacted regions. And in many of these other more urban areas as well, there are actually dairy processing. So a lot of the current hypotheses are around dairy processing or dairy waste being fed into these wastewater sheds, but a lot of ongoing investigations there. Next slide. And this is kind of just to outline that, looking at permitted discharges. So this is where it's actually known that, for example, a dairy processing plant has a permitted discharge into a sanitary sewer or other infected animal byproducts. And then there could, of course, be infected wild animals. And right now we're seeing, this is and Dr. Conway will know much more about this than I do, but my understanding is we're kind of in the season for Pacific migratory flyways for our wild birds, and we are seeing more both wild birds and poultry flocks that are infected. So could they be, sitting in or right at these wastewater sheds? And some of these are said to be closed watersheds, and some are supposed to be open. But like many other things, we are learning that you've seen one wastewater shed, you've seen one wastewater shed. So there's a lot of unique aspects about each one of these. Similarly, there could be other wild animals or animal market inputs via runoff or stormwater or sewer systems. We did have earlier post seeing a live bird market positive, some sewer sheds positive in that area. So these have been unconfirmed as a possible source, but also possible in the right situation. And then what we really don't know about, but is a possible source, is could you have an infected human inputting to the sanitary sewer, or someone who's ingested, for example, pasteurized product with PCR particles that are non-viable. So a lot still needs to be learned about this. This has definitely not been confirmed as a source in any locations inside or outside of California, and you'd likely need a high number of cases to cause that wastewater surveillance detection. Next slide. So as far as our current recommendations about testing suspected human cases, again, just sort of a reminder to all of you as clinicians that symptomatic people who might have an exposure to infected animals, so dairy workers, poultry workers, especially agricultural workers, we know there have been more concern and reports now with more wild animal detections. There are wildlife workers. Again, hopefully they're all using the appropriate personal protective equipment, but if any individuals have symptoms, that to get those tested. We do recommend getting them tested and collecting the specimens by any of you as clinicians, but making sure they get sent to a public health laboratory with H5 testing capability that can really expedite not only the testing, but also the follow-up public health interventions and investigation. So that can be done again at many of our local health departments. Last month I showed you kind of the map of where we can do it in California, and then also our viral rickettsial disease lab at our state health department should always get notified as well. And then the CDC has started contracts with multiple private labs, and the first one that is up and running is Quest. So they can also test for H5 in low suspicion cases, and it's a great way that we have some increased capacity as well. Again, if it's a high suspicion case with a known exposure, we really recommend that get to a public health lab as soon as possible, though. And then just a reminder, too, that many of your systems do subtyping all the time, where you look at, once you have flu A, looking at if you can do H1 or H3 testing. And if you know it's H1 or H3, then you've basically ruled out any H5. Next slide. And also just a reminder, touched on this last time as well, but the CDC recommendations for healthcare personnel as far as your own personal protective equipment if you're caring for someone with suspect avian flu is to use standard and airborne and contact precautions. So keeping in mind doing all three of those to make sure you and your colleagues are well protected. Next slide. So I also just wanted to shift gear and come full circle, a nice sort of complement again to what Dr. Conway was talking about as far as other emerging One Health issues. So vector-borne diseases are a really, really classic example of that. Dr. Conway mentioned even a serology study of looking at pets and how many of them had been exposed to West Nile virus. And West Nile virus, is a really interesting cycle with endemic Culex mosquitoes here in California. There can be birds that are infected. And they have their own cycle, and then there can be some other hosts like horses, and then rarely you can have humans be infected as well. And certainly we've seen that increase ever since our first detection of West Nile virus in California in 2003. And then dengue virus is another one that I wanted to include and mention as also a mosquito-borne disease, and we now have Aedes mosquitoes in multiple jurisdictions in California, but typically it still has been largely a travel-associated disease. Next slide. And just highlighting again this nexus of environmental health, animal health, and human health, the climate impacts that we have on mosquito-borne diseases. So as we see increasing or rising temperatures, we can see more virus activity for many of these viruses. And when there are extremes of precipitation, whether it's drought years or high precipitation years, we actually can see changes in not only virus activity, but also mosquitoes. So depending on the mosquitoes, we might see in drought years, we might see more bird-mosquito contact. Poor water quality is actually where the Culex mosquitoes are more attracted to. Whereas when you see more high precipitation and these just tiny little areas, like a little capful of water can be a breeding ground for certain kinds of mosquitoes as well. And you can see when there's more rainfall, more mosquitoes as well. Next slide. And so again, just thinking back to dengue case travel history and what we've seen over the last recent years, most of the cases that have been travel associated have been in Latin America, and there's a huge outbreak happening right now in Latin America and specifically in Puerto Rico, and then you can see in some of these other areas as well, as far as the highest proportion of regions of exposure for cases in California. Next slide. And then you can see kind of trends over the years too. And we have actually, over the years, had an average of 151 cases per year. And again, it's gone up and down over time. But of note, and what I wanted to bring up as an emerging issue, is that all of them had been travel associated until last fall, last October. And then there were 2 locally acquired cases in Southern California. And this year we've already had 14 in the LA County area and the San Diego area. So this is a situation now where we had something that was largely travel associated, and now we have a unique situation where we have the right mosquito species, and they are if someone comes back with dengue and there are mosquitoes nearby and they can, within their lifespan, then bite another human, then you can get locally acquired. And we're seeing more of this in the United States overall, and certainly in California. So something else to keep in mind. And again, just thinking about all these nexes of environment and human disease. And again, a lot of other vector-borne diseases. Next slide. Just one last kind of teaser, but to mention, we're seeing specifically at our southern border and in general in our Southern California areas as well, more rickettsial diseases, including Rocky Mountain spotted fever. And this again is another life cycle where you can see, you know, the nexus of animals and humans and tick-borne diseases and other things that we are seeing increase over time. So kind of a teaser for maybe a future topic on vector-borne diseases, but just wanting to highlight again how important the One Health approach is for all of us as we take care of our patients and our populations. Next slide. And yeah, so just coming full circle to the One Health approach, and really appreciate being able to tag team with Dr. Conway today. I think that is it for me. Thank you.
Thank you so much to both of you. Kim, you can pop back on, Dr. Conway, when you have a chance. Great. So we had, as usual, lots of great questions this time, and we'll answer as many as we can. One question, Dr. Conway, and Dr. Pond, you can answer too if you have some thoughts, is how do we apply this in our clinical setting? Dr. Conway, you sort of alluded to that. How can we have physicians be stewards and really share that with their patients? So what's the role of primary care providers in One Health?
Yeah, thanks for that great question. I think a lot of it comes from just the perspective that you go into your exam room with, and just thinking that it's not just, I don't know if this question came from a vet or a physician, but you know, it's not just that person or the animal sitting in front of you, but there's probably an animal or a human in that household, and they're sharing the same environment. And so making sure you're asking about animal or environmental exposures in your history taking. I also would love to see, and I don't know what this would look like, but I would love to see an opportunity where physicians and veterinarians can more regularly consult on cases. You know, maybe something that the CMA and the CVMA could collaborate on and have a forum where people could consult and maybe talk about things about, like, I know rabies is a big one where there's a gap in understanding prophylaxis because the guidelines are changing and where to get patients treated. And so if we could collaborate a little bit more, I think that would be awesome.
Yeah, I agree. And I think a couple of things I would add are, I was actually trying to find a slide about taking a good history. And I know it's hard, like we all have, you know, less and less time with patients, but as an infectious disease doctor, right, we always want you to be asking about, like, if you see a patient with a febrile illness and or, you know, anything out of the ordinary, or in this case, you know, even conjunctivitis, if you have an agricultural worker, just making sure you're asking those questions, just to hammer home what Dr. Conway is saying, like ask about travel, ask about animal histories, and think about those interesting exposures, ask about raw consumption of raw products, especially if something is looking more out of the ordinary. But I think it's really good practice to try to have just a few key questions about those things. And I think, you know, the other nexus and just hearing and thinking more about One Health is as we are closer and closer to our pets, as Dr. Conway was highlighting, there's more antibiotic resistant like wound infections, and I think as as I think I learned more that vets are learning more about like kind of practices in the vet clinics that are going to need to be more similar to what we do in human health as far as just decontamination of all the medical procedural, equipment we use and other things, which we're, and that is actually what we're seeing with the dairy herds as far as passing between herds. There's a lot of just contaminated equipment and other things. So I think there's a lot to learn from each other in all of these areas.
Great, thanks. Another of our, oh, go ahead, yeah.
Dr. Pond reminded me of another perspective is that I recently heard of this amazing veterinary clinic in California, and I can try to find the name of it, but they had done an initiative to make a net zero carbon footprint in their practice. And so finding a way to reduce emissions from their vet clinic, reducing their medical waste. I mean, it was amazing, changing all their light. So that's just a way that literally in the clinical setting, having a little bit more green alternatives could be a good option as well.
Yeah, great. Another of our participants said, which is very exciting, I'm gathering information so we can create a One Health program in our county. So I wonder if there are sort of state resources that can help folks in counties coordinate, communicate, introduce One Health at the local level.
First, I would say I would love to connect with you. Please email me. This is something that our program is really engaged with, is collaborating with local health jurisdictions in California who are looking to do this. And one of the big projects we just bid off this year is creating a One Health implementation toolkit specifically for local health jurisdictions. So it probably will be quite a few months before that comes out, but I want to make sure I get that in your hands. But if you're in a county I haven't connected with, there's lots of things we're doing at the state level that I'd love to connect with you for. So please reach out.
Great, exciting. I'm going to pivot over, Erica, to some questions that we've gotten about sort of routine flu and COVID season. One question was, when will the combined flu and COVID vaccine be available? Do you have any information on that? And is it time to get flu and COVID vaccines now?
Sure, I will answer those in maybe reverse order. It is definitely time to get your COVID and flu vaccine. And then if any of you are eligible, or reminding you are eligible patients for RSV, including pregnant women, really, really important to get pregnant women their RSV vaccines, and that can really help protect the infant. Sorry that I didn't include that slide this time. There was just so much great stuff to talk about with One Health, but we are seeing just I think a slight increase in RSV activity, and probably kind of early on, haven't seen much bump yet in COVID or flu, but I think now is time, especially before, a lot of our winter holidays, as our weather's getting colder. As far as the combined vaccine, I have not heard an update on that, but I will ask our immunization team, and maybe next month I can give an update on that.
Great, thanks. And speaking of RSV, one of our participants asked, why isn't RSV vaccine either approved or recommended for pediatricians? And as a pediatrician who got bronchiolitis for the first time in my practice, and probably multiple times, I appreciate that question. Would love to hear your thoughts, Dr. Pond.
That's a really interesting question. I think, right now the priority has definitely been those who are at risk for the most severe disease, who we've seen in the hospital, infant sort of hospitalizations and deaths, and elderly hospitalizations and deaths. But I think over time, as we continue to work on this vaccine and others, as we all know too, it used to be that we could only have this, passive antibody that was only it only lasted a month, and it was once a month, and only for the highest risk, preemies and congenital cardiac disease. And it's great that we have more options now. So it's a great question.
Thanks. So, Dr. Conway, sort of putting on the advocacy hat, CMA is able to do a lot of public health advocacy, and we're grateful for our public health partners who can really be the experts behind that. One question is around veterinary use of antibiotics. If there's any sort of, given this One Health approach, and particularly these increasing antibiotic resistance, is there a movement to talk more about decreasing the use of antibiotics in animals? And if so, how can we help?
That is a good question. Um, in terms of decreasing antibiotic use in animals, I think maybe more appropriately saying like using antibiotics appropriately when they're needed, and discouraging reaching for them when they're not. I think, and again, I really meant it when I was saying I would love to hear from physicians what barriers they face, because I know what barriers companion animals face, and we just did a whole study looking at this. And um, client education can be really, really challenging, and so I think it's a complex issue, right?
And just to clarify, I think this was largely around farm animals and, using
Oh,
antibiotics to help cows grow bigger and the variety of reason that, which I'm not an expert on, animals are used in more, antibiotics are used in the farm setting.
yeah, got it. Thank you for clarifying. Um, so at least in California, the antibiotic use in livestock is restricted, and so it shouldn't be used for growth promotion. I will say I'll probably have to defer this question to an amazing program we have. It's the CDFA Antimicrobial Use and Stewardship Program, and they oversee all of the antimicrobial use in livestock in California. They've had some great reports come out. They've done some studies, but they're probably the best resource to get some of those questions answered.
Great. So I imagine people can find that online, but maybe Dr. Conway also be in touch with you to sort of hand them off if they have specific questions there. Wonderful. One other question. I love that this One Health approach really discusses human, animal, and climate health. And now in this state and in medicine in general, we're really framing a lot of questions also around health equity and justice. And so just wonder, there's some obvious connections here for me, but if you can talk about how this approach can really impact and hopefully improve health equity and justice in our state.
Yeah, I'll take a first stab, and then Dr. Pond, feel free to jump in. So that's something I'm really glad you brought up. And we recently held some One Health focus groups in our state and different partners to understand what does a One Health approach really look like in California. And one of the themes that got brought up multiple times was health equity, and that a lot of the challenges that we're seeing, zoonotic diseases, vector-borne diseases, food insecurity, those impacts are impacting our under-resourced communities harder than our resource communities. And so when we take a One Health approach, we should be taking these new novel solutions and bringing them to the under-resourced communities first and solving problems there first.
Yeah, I agree. I mean, I think everything from just thinking about where climate impacts in general are, like we know our kind of urban heat, I'm blanking on the right word for that, but right, like we just know that a lot of our inner city urban areas are the ones who don't have as much tree cover, they don't have as much sort of shade and are more vulnerable to the heat extremes. We also know, I think, thinking about some of the vector-borne diseases, outdoor workers and farm workers are like at higher risk for many of these kind of both and actually it's come up just circling back to H5N1, thinking about the balance of what's the balance of personal protective equipment to protect you from bird flu from the cow you're milking versus heat illness, right? And like, how do you make sure that balance is right? And then where we're seeing more mosquito-borne diseases sometimes is also in lower income neighborhoods. So it kind of boils down to like place matters, environment matters, right? For all these things. And just really, really want to echo the important point about, and let's put our resources where they're needed the most. Really proud that California has really focused on that and really using data more and more to do that, and really making sure we're prioritizing resources where they're needed the most.
Great, thank you. Well, we continue to have great questions and hands raised. I wish we had more time, but really appreciative, Drs. Conway and Pond, for coming today, talking about this important approach. just a reminder that you will receive that survey at 5 o'clock today. So if you want CME, then fill that out and we'll get your certificates to you within a week. And also just a reminder that we do record this webinar. It's on our website. The email will include instructions about how to get to it, but you can just look up our website where you registered. And then finally, just to tell everyone, we will not have a session in December. So have a wonderful holiday season and we'll see you again in January. Thanks so much, everyone, for participating.